Here.
Okay.
So we're just waiting on Jones and Stevens.
Okay. All right. Well, in the interest of time, I want to get things started. I'd like to call to order the Cuyahoga County Health and Human Service and Aging Committee meeting to order. Madam Clerk, if you can have a roll call, please.
On the roll, Ms. Conwell.
Present.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Brown.
Here.
Mr. Miller.
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. We have a quorum.
All right. Madam Clerk, if you could let us know when they join us, that would be appreciated.
Okay.
Has anyone signed in for public comment? I didn't see any.
No, Madam Chair, no one submitted any public comment.
All right. The next item on the agenda is the approval of the minutes from the October 21st, 2020 meeting. Can I have a motion and a second?
I so move.
Second, Brown.
All right, moved and seconded. All in favor, say aye.
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 Minutes have been approved. I don't have to keep touching the screen. This is so wild because usually I'm muting after every conversation, so I can leave mine on actually. Matters referred to the committee today, there were none. We do have a presentation by the Division of Children and Family Services Advisory Board. We fought long and hard to reestablish that board due to the death of some children. God bless them and their families. And so we would like to hear today from what they've been doing up to date since they've been established, and reading over the document that you sent, there has been a lot. So we're looking forward to hearing from you guys today. And I don't know, Director Weiskettel, would you like to have anything to say?
Well, I would just like to introduce the chair and co-chair of the advisory board. So the chair of our board is Lakeisha Wild. We're thrilled to have her. Lakeisha is actually an original member of the board. And then also Gabriella Celeste is on the board as an original member and is serving as the co-chair. So they put a report together that they're going to go ahead and go over with you guys. And then certainly they or myself will be glad to answer any questions.
Thank you.
Go ahead, Lakeisha. I don't know who's going first.
Thanks, Director. I'm going to go first, but be very quick and turn it over to Lakeisha on this new role. But I just wanted to say thank you to Madam Chair Conwell and to, I don't know if Vice Chair Jones has joined us yet, but to all the members for your concern and attention and for your support of this advisory board. We have been particularly grateful to Director Weiskettel and her team that's really helped support us during this time, as well as folks like I see Michelle Pomeritz and Jennifer Grossman at the division, David Merriman, who's also been responsive to some of our advocacy issues. So we've just been really impressed, frankly, with the kind of support we've gotten from the county and its staff throughout this process. And we've also been challenged, and I think Lakeisha is going to share with you some of that. I will just say briefly that I only came on I served as the interim chair essentially for this year when we lost, not lost, but when Kristen Farmer had to make a decision to step down. And I am super, super grateful and thrilled that Lakeisha, who's been a part of this from the beginning, agreed when I said I would chair. I would only do it temporarily to help support this and that Lakeisha really taking on the reins. So she's just become chair at our last meeting. And I'd love it, Lakeisha, if you can kind of walk us through where we are at and we can go from there.
Hi, everybody. I'm Lakeisha. As Gabriella said, I'm the chair of the Division of Children and Family Services Advisory Board. We were officially appointed in February of 2019. So that's kind of where this the basis of this information is coming from, starting from then till now. I'm going to jump to our committees that we created. It was important that we created our bylaws, which we did do that. And then we created 3 different committees. So we have the intervention committee, we have the prevention committee, and the governance committee. And we have everybody serving on at least one of those committees, or a couple, some people do a couple. So some of the things that are important to us that we kind of came together as an agreement was transparency, making our meetings available to the public. I will say though, that has changed due to COVID. So we are looking at some other ways to kind of make it available to the public. I know that it is posted on the DCFS website, and that is one way, but we're looking into some other ways to get people's input on these matters. So just looking at my notes, I think I'll move on to get to our activities and our priorities. So like I said, we drafted the bylaws, and then we have the 3 standing committees. I spoke on that. The biggest thing that has been really helpful for us, going forth to try to figure out where we need to be of support and help is when we get updates from the DCFS, the director's update that has been very instrumental in us knowing where to go. And we are very thankful for that. Also, when we had started, when we came together first as a board, we did receive a letter from Councilwoman Conwell, and that we do refer back to that letter to try to make sure we're trying to address some of those matters. We have been working on that. Another piece is our advocacy. That is very, very important to us coming together. So I want to take a time to talk about what our advocacy has been in the past year. So the COVID-19 pandemic has made some challenges and things have been unique because of that. But there have been 2 different things that have been very important to us that we were trying to advocate on. And that first being the backlog of cases and terminations due to extended delay in the juvenile court proceedings to hear cases. So a letter was sent, and in that matter, it was addressed. And then the second being the temporary shelter of children in the DCFS Jane Edna Hunter building. That letter was sent, and we have gotten updates from the director of the DCFS, and that has been addressed as well. Another part of we have been establishing, another part is processing and monitoring for key data. That has been started by the intervention committee by Dr. David Crampton. He has taken the lead on that. And that is getting information from about 9 broad categories that were from the Independent Child Welfare Review. And we get information and data from that. And there's just 9 different categories. We're still in the process of working on and trying to figure out what specific key data that we actually need, because we know there's a lot of data out there. So we're trying to monitor it and see what is going to be best helpful for us going forward. But that is exciting because we feel like it's giving us what we need to know about certain things. Another area is our prevention focus. So there's a few key things that have been going on with the prevention committee, which is chaired by Angela Newman. So it started off where a group called Invest in Children did a presentation to us about child protection teams. So from that presentation, we were interested in wanting to know more about child protection teams and how that might benefit Cuyahoga County. And from that, then now I believe a whiteboard has been created and is in the process with Case Western Reserve University Schubert Center for Children's Studies, so that we can better understand and see how that could or may not benefit us. So that is in the works, and that hopefully by the end of this year, we will have more information on that. The next part is another advocacy piece is we know there's been a Citizens Advisory Council on Equity that is newly formed. And our goal is to be in collaboration with this board to adopt a resolution and acknowledge certain priorities in that area. So we are still working on that. We are going to be bringing it to our board at our December 7th meeting to kind of more bring it together. But that is our goal, is to work side by side with the city's advisory council on equity, on racial issues and those things. So I'm just looking at my notes to make sure I hit everything. I'm a little nervous, so I'm just trying to make sure I reach everything. But I think that now brings us to the public outreach and communications. This is really important to me, as I know that it is important to our board, hearing directly from families, young people, and providers and other people connected to the DCFS. So we're trying to find ways to get more information and more conversation along that. But because of COVID, like I said, that kind of changes how we go about doing that. And I think this is something we plan to revisit and explore more effective remote options. So I actually see one now that is going on. You guys are doing the YouTube live. So with that, if there are any questions, I definitely will try to answer the questions. And if it's something that I feel like I don't have the ability to, I have Gabriella Celeste, and we also have Director Weiskettle. So I appreciate your time. Any questions?
Miss Wild, where do you think is your next steps? What is the next steps?
I think the next steps, like at the board meeting, I think because a lot of our questions come from the data that we get, I think we, for getting the data piece that we've been working on, the data dashboard, trying to get that more cohesive. So that's what I think. I'd love to hear what Gabriella thinks as well.
Yeah, I think that's absolutely right. I mean, this is, as you heard, basically we've been involved in two big sort of buckets of tasks. I mean, the internal kind of operations and how do we have a process for improvement that can support the division, but also looking for opportunities for kind of cross collaboration as it relates to, like Lakeisha said, whether it's around prevention or intervention, or issues that come up that require kind of more ad hoc kind of advocacy. So I think a next step is, of course, to make sure we're informed in a way that is a kind of sustainable way. We think once we have this dashboard together, which we have it actually a pretty good draft, but once we have that together, we'll have a better sense of how do we continue to monitor in an effective way. But I would also say that this child protection team, the system-wide child protection team model, is something that we're excited about the potential for that. This is nothing, it would be new to our county, but the idea here is that we really think about how the hospital systems can work in a more collaborative fashion to address kind of red flag issues with kids that they see come through their systems, to have a way of addressing that more systematically and hopefully preventing more serious instances of abuse. So prevention, I know all of us would love to see us be more effective in that way. And so we're hopeful that we learn some more from that and then see what might be next steps for this body and for our county leadership to really think about. But we're not there yet. We're still, as Lakeisha said, we're still gathering information. So I would say it's those two kind of areas.
Okay. And I was reading over the document, and it's one of the things that stuck out to me was that you really needed help in terms of the public outreach and communication for the families or the citizens. So do you have any ideas on, I was trying to roll it around in my head, trying to think of ways that we could get that information out. And I know the digital divide is a big issue.
Yeah, so if I could say two things, and Lakeisha, you may want to add to this, but one is that we did participate in this, at least it was in the regional meeting of the state. They did the sort of talking, I guess, town hall type meetings last fall, and we participated in order to get a sense of what how our community was, what they saw as key issues to help inform us. And we, with Verna Darby, who's just, as you all know, has just joined our advisory board, and she's with Birthing Beautiful Communities. She's has some ideas that she'd like to share with us about, the work that they're doing as part of BBC and potentially connecting with moms and families that way. But the truth is, this has been, even before COVID, candidly, we did not have, we've been having had meetings around the county. We were trying to not do it down, at the Jane Edna building, but really try and get out. So thanks Cindy and her team for trying to make that happen. But even with that, it wasn't like we were having people come to these necessarily. So I think you're exactly right, Madam Chair. It's something that we need to be more intentional about. And I think we're open to your thoughts. Lakeisha, did you want to add anything with that?
Just that I think it's an important time to trying to reach people because of COVID. I just know that there's a lot of struggles out there, and I think it's always an important time, but now more than ever to, hear what's going on and what needs are needing to be met.
Excuse me, Madam Chair, I'd like the record to reflect that Councilmember Jones is in attendance.
Thank you.
Thank you.
And I'd like to just say that Councilwoman Stevens is tied up in something, so she will not be able to join us today. We do not need to vote on it, but I would just like to publicly excuse her. Thank you, Councilman Jones, for joining us. My question or not a question, I guess a statement to Director Weiskettle would be, are there any sort of documents or ways we could reach out to the families? I don't have a full understanding of how you reach out to the families that are involved in the child welfare system now, and just wondering if we could incorporate some kind of notification on the letter or whatever that we do have this DCFS Citizens Advisory Board, and that they're basically working toward advocacy. I'm just thinking off the cuff.
So, the families that we serve, so we have routine letters with our foster parents, with our relative caregivers, with our collaborative partners, our community partners. As far as families, we do send letters out, but mostly the letters are, we don't tend to do mass mailings. We tend to do as necessary. So if I need to schedule an appointment and you're a family that doesn't have a phone, a way for me to reach you, then I may send you a letter. Sometimes we send documentation out of meetings we hold in response to what's going on with the kids. So if these are kids in custody, we are required to hold a certain amount of meetings a year about the custody and things like that. I'm wondering about, we do have a community newsletter. It doesn't necessarily go to families. It can go to families, but we do have a community outreach newsletter we put out. I wonder, I don't know, Gabriella and Lakeisha, what you're thinking. I wonder, I know you want to speak to families, but I also wonder some of these other subsets might be of interest too, like the kinship providers. That's a group of people you may want to have some dialogue with, or, foster parents or whomever. I mean, we also have our teen groups. So I think we could try, if the board wanted to craft a letter about the advisory board, we in fact could do a mass mailing to all families that are currently open with us, inviting them for their feedback. I don't see any reason why we couldn't do that.
I would like to say that I have reached out to some of the people that I know personally who are kinship.
Mhm.
And I think there was a little bit of, yes, they would like to be a part of it, but I think there's hesitation. And so I have reached out to some of the people I know.
Mhm.
Just because this has now come up a couple times, I guess we'd be remiss not to say that one of our biggest, I don't know if it's a concern, but certainly we see the need for more support for kinship care and kin families to be a significant priority. We heard that the meetings that the state held around the state, and one that we went to here in our community, that came up repeatedly. Certainly Director Weiskettle's brought this to our attention. And so anything that can be done to actually increase the level of support for kin care is something that we recognize as really vital to this for families.
Well, we have nearly more than a third of our children are placed with kin. And so we are getting ready in the next year to start per diems to our kin. They won't completely match foster care per diems, but we're building toward that. The kinship families will still be eligible for child-only benefits as appropriate and food stamps. So one of the things I would like to do in the new year is really look at overall stability of children in kinship placement. Research is really clear that if you can keep kids with their family, the likelihood of stability goes up. I think likelihood of permanency goes up. I think there's lots of good stuff that comes from kids staying with their family. Foster parents are wonderful people, thank God for them, but they are still strangers to children when children come into care. So where we can provide additional support. So I would like to look at our PEI people doing some evaluation of how our kids are doing in kin placement. We were doing it like a hand count early on, and it felt like we saw better stability in the placements, but I would like a bigger evaluation of kin placement. And then I think what could be a part of that is questions to the kin about how else we could be supportive to them. Might be a really, I'm thrilled we have over a third of our kids with kin. I think that's wonderful. I think we could improve that number, and I'd like to see us do that.
So is there something already in place for support? Because I know some of the kin, they're already meeting groups and they're already supporting each other. Is there something in place like that where they can support each other and then have other supports and information?
Yes, so as we've all talked, the pandemic has thrown a lot of things to the wind, but we do have what are called cluster groups. And one of the cluster groups are kin placements. So there is an opportunity. I mean, we have to come out of this pandemic at some point, hopefully anyway. But I do think the emphasis of kin is a key to child welfare, really, making some real strides in some of the most important areas in kids' lives. So I do think we want to focus some energy on that. I know internally our plan is in the new year to try to get an evaluation of it going and seeing what other supports. We do provide, Lakeisha, the same kind of supports we would provide in a foster home. So if a kid is placed in foster care and they're struggling in foster care, we can put services into the foster home to try to stabilize the placement. We can do the same thing for relatives. So if a relative takes a child in and the child's been with them for a period of time and the young person is traumatized or they're angry or whatever, we can put services in to support the relative trying to maintain placement of that child.
And Director Weisskettle, what is the number of children in the county care at the moment?
It's about 28, 24. So we're down a couple hundred kids from this time last year. As I think Gabriella said at the beginning, when the pandemic started, we had a huge number of kids ready to go home, but the court wasn't doing reunifications. We have, with your help as well as the board's help, really eliminated that backlog. And we have been in conversation with the courts to make sure if we would go into a total shutdown again, that the hope would be the court would have a better way of managing those cases so they wouldn't just sit again. So we're doing pretty well with that.
I'd like to open it up to my colleagues if they have any questions.
Madam Chair.
Madam Chair.
Councilman Jones, and then I heard Miller.
Okay, thank you. Ms. Weiskettle,
Yeah.
you mentioned there are just under 3,000 children in our custody. Can you break that down in age? How many, what is the age ranges from?
Well, so children can be in custody from 0 to age 21. Any children between the ages of 18 and 21 are typically children that either haven't finished high school and/or children who have been identified for placement through the developmental centers, and they don't transition out of child welfare in Cuyahoga County until 21. They move over to the other system. Do you want the actual percentages by age? Is that what you're looking for?
Right. How many are
I can
18 to
send
21? How many are
you.
high school? How many are babies? How many are,
So, in child welfare, typically the younger the child, the less ability they have to self-protect, the more likelihood they would come into custody. But I can send you the percentages, like how many kids under 5, how many kids 5 to 10. If that's what you're looking for, I can certainly send it.
Right. Okay.
Councilman Miller.
Madam Chair, I would just like to make the advisory committee aware of the Great Lakes Regional Child Abuse Prevention Council, which I'm the chairperson of, and it covers the counties of Cuyahoga County, Lake County, Geauga County, and Ashtabula County, and we've been operating under the state model that's existed for about 5 years now, where we have 8 regional councils for the state. And we run a variety of primary and secondary prevention programs, doing public awareness and even more so prevention work with high-risk families. So if you would like to learn more about the work of the Prevention Council, I would invite you to get in touch with me, and I'd be happy to talk about it further.
Thank you, Councilman Miller. Yeah, we would, that would be terrific.
Great, thank you.
All right. Any other comments from my colleagues or questions?
Yes, I would, Madam Chair.
Councilman Jones.
Thank you. I just wanted to ask about the Jane Edna Hunter building. We've had conversations. I've talked with Director Merriman, and I'll tell you, I was approached by staff a good three or 4 months ago, and they were concerned about their own work description, the requirements of having to deal with the children who had been brought in for abuse and neglect, and in that window of time between being brought into the Jane Edna Hunter and when they were being placed. So over these few months, I've talked with Director Merriman, and I know there are works in place to deal with the challenges that we have there. We've all seen the news coverage that we've gotten of what has happened to employees being physically attacked, and I think there was an instance of a car running into the building. But again, just wanted to get a sense of where we are, with your sense of how you can address the problem, and if it has been, if there have been any budget dollars dedicated to the solutions.
So I'm pleased to announce we've made huge strides. We have not had a child spend more than 24 hours in this building in over 90 days. Most of the kids are spending well beneath 24 hours. The one child last month who got stuck here for that long, we were actually waiting the results of a COVID test. Some of our providers will not take a child without the COVID results. So we've made huge strides. We have no child spending the night, multiple nights here. We do not have any, as I said, we are collecting huge amounts of data. Most of the kids are spending, a good third of the kids spend just under an hour or two in the building. So kids are still coming in for several reasons. The police can bring a child in because they find a child unsafe. And by the police giving us the child, we now have custody of that child. Some of those children are going to sit in the child care room for a little while to give us time to investigate to see if we need to keep custody of that child. Many times we can return that child to the parent or do a safety plan and the child doesn't have to remain in custody. We have developed additional resources with our providers. We continue to work on developing additional resources with our providers. Thankfully, we have not had an incident in over 90 days of a staff person being assaulted. We are working closely with protective services. We're getting ready to launch some new things with protective services to make sure they search kids on the way in. We're making sure they're not carrying weapons. We're going to have the kids sign an agreement of how they will behave in the building. I understand that doesn't mean they'll do it, but it is our attempt to really be clear with our expectations. We also have 2 proposals we have received around what people refer to as an emergency child care center. And so what that really is in reference to is the idea that if we could not find placement, the children would not spend nights living in the Jane Edna Hunter building. We are in the process of looking at those 2 proposals, and then we will be making recommendations on whether or not a contract will be put in place. I think what's difficult, or what I'm very proud of, even in the middle of COVID, even in the middle of positive kids for COVID, we still have not had children spend more than a night in this building. So, remember, a kid could come in at 11 o'clock at night. It's not likely we'll find a placement within an hour. So that child may stay till the next morning until providers are up and going and we can get that child placed. So we've made huge strides. But there is about 1.5 million set aside for this emergency child care center we're talking about. We've also, there's something in child welfare called 30 Day to Family. And 30 Day to Family is a concept around the search for family up front whenever an agency comes in contact with a child. And 30 Day to Family proposes that we find up to 70 family members for that child. So for kids that are coming in that were in the child care room and we're having trouble figuring out a placement for them, we've also assigned a 30 Day to Family staff person to go down and really start the work around the family tree and who your family is, and really expanding our opportunity to get that child placed quicker.
Well, Ms. Wise-Kettle, I think that's good news, great news. It's good to hear that.
It is good.
A few questions. You said they would not be in the Jane Edna Hunter building more than 24 hours. But I guess it doesn't cover the actual placement. Is that the same 24 hours and you've placed them, or 24 hours and are they going to another location within 24 hours?
No, currently right now, from when they come in the building, they leave within 24 hours to go to their placement. Whether it's a foster home, whether it's a residential facility, whether it's a group home, whether it's relative, they leave the agency to go to their placement.
What adjustments did you make to be able to make that quick turnaround?
Councilman, I have a little bit of trouble, for lack of a better way of saying it. We are working so hard on this issue, and it is the focus of everyone in this building. And we are collectively pushing all in the same direction. We're calling in every favor we have. We're being very open to being creative in our placements. We actually had a young man who was in placement who tested positive for COVID, and we weren't able to find a placement. And with David Merriman's help, we actually had his mother stay in a hotel with him, and we helped pay for it so that he was with his mom and not in the building for 2 weeks while he got through the COVID scare. So we are using every tool we have available to us to try to ensure we can continue this success rate.
Has that caused?
Councilman, if I could also just add to that, I think Director Weisskettel has shown exceptional leadership in this as well. She has brought together her team, Jackie McCrae, Tammy Chapman-Wagner, Chris Cabot, and then their teams, David Gray, and many, many, many others, the hotline staff, all the way down. And I have to tell you, there has been such an exceptional team approach here that, it has taken, it's not a strategy, it's many strategies. Everyone doing everything they can. It is of a little, I don't want to say it's of concern to me, simply because the amount of time and energy they're putting into this is enormous. And I know for them, they're all committed to what's in the best interest of the child. And that still is the top priority. But, Cindy, Jackie, Tammy, Chris, and all the rest of the staff that are working on this are also saying, what do we have to do for the environment and the other children that are in this building? They're doing a great job. And I commend them on their ability to keep this up.
And I agree with you. I think it's fantastic. You've done great work. It was certainly was a problem, but the effort of trying to address it and all that's being done, I'm happy with it. Having deep dived into it, I just like a few details about what has happened. Are you able to have these changes been within your budget, or do you expect any budgetary asks as a result of what you've done, and is it sustainable, what you've done?
So I think the money we were allotted for the emergency shelter, as well as we designated a little bit of the kinship money we got to be able to hire a few staff to do the 30-day to family model that has been so successful. I believe at this point we will be able to live within our budget. I would tell you, I have to believe overtime has gone down. What I'm spending on overtime must have gone down. I don't have people living here in the building with children, so I must have made ground on my overtime. So overall, I believe we will stay within our budget.
Excellent.
Can I just amend that slightly and say the proposal is to add the additional levy dollars to this? And I'm just recognizing that council has to still pass that budget. But the 1.5 million is in the proposal that is before council at this time.
I apologize. I jumped ahead. Sorry.
It's that Councilman Miller's on the call, and I know that he tracks these things very, very closely.
All right. Well, one thing, or just an observation that I made when I was there and I saw the child care room, what immediately resonated with me was these are our children, they're here, and mentoring could be a key, as opposed to, obviously using our law enforcement component, all those things. But these children at the end of the road, so to speak, and might be in their own minds, and having, just as we've done in closing the achievement gap, placing a mentor in the high school, I could see this as an opportunity to place a mentor in that room as well, even for the 24 hours they're there, just for some light intervention, a light encouragement, those type of things. It's just a thought, but I figured I'd throw it out there.
We certainly could look at that, Councilman. The thing that would be hard to predict would be, there are plenty of days there's no child in the building. So it would be hard to know how to schedule someone to be here. It would have to be someone on an emergency rotation or something, because we have many a day where there's no child in the building. I mean, we've really gone from kids being here pretty routinely almost to the other extreme. Every afternoon around 2:00, we get an email that tells us if there are kids in the building. And I can tell you many days a week, it'll say there are no children in the building. So we certainly could look at that. I think what would be hard would be the scheduling. We do offer mentoring services to kids that are in custody. So there is mentoring available for kids who are in custody. We've just never done it in the child care room.
Right. One of the strengths that we found in the closing the achievement gap, they call them, instead of mentors, they call them linkage coordinators, because they actually link them to many of the existing wraparound services. So they build a level of trust with the children. So it's actually an opportunity where they might even follow them lightly as they go into their placement. So it would actually act as an additional resource, So while they may not be in the building, a linkage coordinator may have 50 children, and they touch lightly on some and spend more time with the more high risk or more needy children. But they could have in the numbers of 50 children in their purview. So just another component to what could possibly be done.
Mhm.
Are you done, Councilman?
I am. Thank you, Madam Chair.
Okay, I wanted to follow up Director Wise-Kettle or Dave Merriman. We've been hearing a lot about the Emergency Child Care Center. How is this different than the contracts that we have in place with Safi and Providence House?
So the concept that we're talking about that so the idea was to develop a resource that would serve as the place children would remain if we couldn't get in place. So if Safi didn't have a placement, if Providence House didn't have a placement, if we weren't able to find a relative, then this facility or facilities would be where the children remain until a placement was found, instead of having them remain in the building. So the facility would be a much more home-like facility than being in the office building with us until we could find placement.
So what does that model look like? More family homes, or I'm envisioning a building that somebody is.
The two proposals we got were both from providers who provide an array of services, Councilwoman. They provide some foster care, they provide some residential care, even hospitalization. So they have different levels of care for the children.
Okay, so in moving in this direction, we would still keep our initial contracts with Safi and Providence House?
Absolutely, absolutely. We can't have enough contracts. For us to keep up this kind of momentum, we're constantly looking for additional emergency beds and things like that. So we have options available.
And in moving forward with the, possibly moving forward with the Emergency Child Care Center, how does this relate to the crisis beds that we're just meeting with all the providers and we're determined?
So we have access to the crisis beds. We, like any of the other child serving agencies, have the ability to have a child placed in one of the crisis beds. I believe there are, I may get this wrong, I believe there are 5 crisis beds in the county. I'm not positive. These are typically kids who are having a mental health crisis that ends up in a crisis bed. So we had access to those beds all along. Again, we're all vying for the same beds and there are not enough beds. So sometimes there isn't an opening in a crisis bed, but we certainly can use a crisis bed as openings are available and our kids need that level of intervention.
All right, and I want to go back to one other thing in terms of the when the children are not in the room. You stated that there are many days that there's no one in the room. How is it staffed at that point?
So, this is kind of a new thing for our childcare staff. So our childcare staff are working on other projects. They're working on, right now, we're in the middle of Giving Tree, which is the huge project we do every year around the holidays. They're providing assistance with other kind of tasks that we need help with, sorting and, organizing and gifts and everything else related to that. We will continue to have to look at how we're using the childcare room. And I suppose if we ever got to the point we didn't need the childcare room, then we would look at what other opportunities we could offer these staff. But please remember, once COVID ends, the childcare room will get used during the day, 8 to 4, when parents start coming back in the building to go to meetings. We don't let them take their children into the meetings. And so the childcare staff also provide like a short-term daycare, like babysitting service. So the parents can go off to their meeting and the kids would be in the building. So my suspect is we will always need childcare staff for those kind of services. Like I said, once parents aren't doing these meetings virtually, but are coming back in and sitting at the table, we'll have kids coming in and out of the building for an hour or two while their parents are in a meeting.
Can you send staff or my colleagues and myself a list of all the costs for the proposed emergency child care center, the staff that it costs to staff the children's room, as well as the contracts with Safi and Providence House.
Sure.
What does that total cost? Because it's become a system of just for the same kids, and I just would like to take a look at that. And then the other point, going back to what Councilman Jones brought up, we've had no further incidents. Says you guys have done a great job in the last 90 days in terms of that. But I had made a proposal or a suggestion in terms of the sheriff's department helping and assisting when we're transporting. Can you give us an of children that you think would need that, so we could cut down on the potential incidences with workers? Could you share an update on that?
Sure. So we met with the sheriff and a couple of his staff a few months ago, and we made an agreement where they obviously can't transport every child, but we agreed that if a deputy director or myself reached out to the sheriff because we felt the child's behaviors could endanger the staff transporting them, they would agree to transport. We've asked twice, and they have transported both children. One of the children, they drove all the way nearly to Dayton to pick up for us. So far it's working well. The other thing we have done is mandated that all staff attend training on safety in the community, safety in the building. The reality is these are traumatized children, and sometimes they are going to act out, and sometimes that acting out is physical. And so we are working closer with the protective service we have in the building on how they can assist us if a child does start to get out of control. So it's only been 2 kids, but both times the sheriff has been more than willing to go ahead and transport for us. We intend to continue to ask for that assistance as we need it.
And just to let my colleagues know, this is it's been very great that the sheriff's department was willing to do this, but it's usually when they have no individuals that they need to transport. So it's just kind of worked out right now. So it's no additional cost. They're already paying those officers to be on standby to transport individuals in the correction system. I want to open it up to any further questions from my colleagues. Cool. I'm shivering.
Madam Chair, I'm not a colleague, but I'm wondering if I may ask a question about that last exchange.
Yes.
Thank you. I'll just put out there, and I don't know enough about all of the context here, but I am concerned at the prospect of relying on law enforcement to transfer kids in crisis. And I appreciate actually that Director Weiskettel raised that traumatized children almost predictably will be acting out, and we do need trained professionals. I think if we do rely on law enforcement, minimally they should be trained in crisis intervention and understanding children, and that they're different than adults. Too quickly we can move to sort of criminalize this behavior. So I have real concerns. And in fact, I just heard last night, you all are very familiar with the consent decree that our city's under. Albuquerque, New Mexico is under a similar consent decree with its law enforcement. And I just learned that they actually created a new transportation policy for children under the age of 12 in crisis that says they will no longer be transported in police cars because of the what's resulted. So I only share that. I guess I said I had a question, but mostly I raise it as a cautionary note, and it's something that I'll sort of bring back to our advisory board and think about too. But I appreciate that you're concerned about safety. I'm not suggesting that it's anything but that, but I'm really I just want to share my concerns about relying on law enforcement too much in some of these situations.
And I appreciate that. And that was one of my concerns, and with my conversation with Sheriff Schillings at the time that I suggested it and asked him what his thoughts were, that that making sure that the officers had crisis intervention techniques or training. And also, this wouldn't be just for any child.
Right.
These are children, primarily would probably be teenagers that could actually cause some physical harm to their self, to a staff, or the community. And leaving that up to the professionals in the child welfare system, saying who they would need that transportation, and they know the repeated offenders or the children that are traumatized. So, you know,
Well,
so
and
deeply that they would. So it's not for a regular ongoing, but to show that we as a county was giving some assistance and support to the workers that we have employed with us, because that's a turnover. And we just, just trying to give creative ideas to Director Wisekettle, who juggles that on an ongoing basis, staff coming in and staff going out, because a lot of them not feeling safe.
If I could, we've only used it twice for that exact reason. We are very thoughtful about who we will do this with. And I totally agree with you, Gabriella. I would not support the routine transporting of young children in a vehicle in which there's a cage between them and the people in the front seat. That could cause greater trauma than us trying to use our best skills to help that child de-escalate and help them understand what's going on. So we are being very thoughtful about when we ask the sheriff for assistance.
I have no doubt that you are, and I appreciate it. And thank you for letting me raise that. And if I may just raise one other question or comment based on what I heard earlier. Thank you, Madam Chair. I so appreciate this conversation about the kids at the Jane Edna Hutton building. You all know that we were also very, very concerned and raised a bunch of red flags. And I will say we knew about it because Director Wisekettle told us. So one thing that, as I appreciate as a volunteer citizen on this board, is that she hasn't she didn't try to hide the ball. She was like, this is a problem. And you all should know about it. And I feel like for you, I want to make sure that the council members on this committee understand that that's exactly the kind of relationship we hope, to have with her and her team, that she can share with us. And we're trying to find ways to, support you all of us trying to figure out how to take care of our children. These are all our children. And she said something earlier that I just also really want to highlight. We're talking about the contract, which I do think is important to have this emergency, child care option on the table. But the fact that they also have the 30-day to family option, I just learned about this, I think yesterday, the day before, that they were automatically assigning one of those family finding staff to all those kids. To me, that is the most encouraging sign that they're really looking to try and find a place with people that these kids would know, someone naturally in their neighborhood or family or extended family. And so I think the combination of both of those, having both the emergency care center should you need that, but actively trying to find a family connection is essential. And the fact that they're doing that, which I just learned about and heard again today, is really encouraging. So thank you.
Thank you. Opening it up one last time for my colleagues. Any further questions or comments for any of the participants today? Hearing none.
Councilwoman, if I could just add that I also want to recognize Lakeisha Wild. I think she's come on in this new role and has shown a lot of interest and a lot of passion. And just as someone that's worked in this field for a little while, I don't have Cindy's tenure. I recognize how valuable it is to bring new people to the discussion, new points of view, and how grateful I am to her for her commitment. This is a lot of work. She's putting in a lot of time. She's stacking this at the end of busy days where she's got her own job. And I just think we have to recognize when we have citizens step forward and do this great work for us. And so I want to express that recognition and gratitude to Ms. Wild.
All right, thank you. Any of my colleagues going once, twice? Okay, I would like to thank each of you for your participation in this needed advisory board. Your hard work and to date is very much appreciated. Even though you do not have any final decision making, I think advocacy and policy changes really come from the community and their point of view and how things should be changed. So this is a very, you are valued. I just want to say that. And I know all my colleagues feel the same. This is something that is needed. Unfortunately, it got regenerated at the death of a child, but hopefully in moving forward with your dedication and the future members that will join this advisory board, that we can hone in onto some of these issues that happen with children and families, and we can prevent some deaths. So thank you, and thank you for your time and attention for joining us. And we look forward for you to keep us up in updates. I would look to the future for possibly, unless there's something urgent you would like to bring to our attention, you're more than welcome to always get on our calendar. But I would like to move forward in the new year, since we have so many departments in HHS and advisory groups and things that are expanding, looking for every 6-month review on each and every one of those. And me and Levine, our policy analyst right now, is working on those dates. So you can pretty much look forward to yours being 6 months from now to give us some updates. We're trying to keep with that mantra. And again, thank you. Madam Clerk, is there any miscellaneous business? Anything from my colleagues?
No, Madam Chair, nothing from us.
All right. Well, thank you. This meeting is adjourned, and have a blessed and safe day.
Thanks.
Thank you.
Thank you.